injection of material into the body is a medical problem, because you will always create an inflammatory response and the body's need to reject that material and attack it. Why do you think we're having so many food allergies? Because there are food proteins in vaccines. Starting from the vitamin K shot that babies are given at birth.
What's in the vitamin K?
Egg phospholipid and castor oil. And all you have to do is do a literature search. Does castor oil cross-react with peanuts and tree nuts? And the answer is yes.
Allergies were unheard of before the invention of the hypodermic needle. Allergies were not even a known phenomenon. So you think about hypodermic means under the skin, so you're taking a substance, it's coming through a needle, it's going under your skin into your body in an unnatural way, not entering through the nose or the mouth. And this is the genesis of the birth of allergies. Heather Fraser was a historian. She wasn't a medical person, but her own son, when she first gave him a peanut around the age of 1, he had an anaphylactic reaction, and she didn't understand why her son was allergic to peanuts, the way, of course, many other children are as well. And she did a deep dive into the research and wrote this book, The Peanut Allergy Epidemic, which has so many references, very well researched. And she uncovered the fact that the Hib vaccine, the Haemophilus influenza B vaccine, which is one of the vaccines that's given for meningitis and invasive bacteria that can cause, other illnesses. And I don't make light of Haemophilus illnesses because they can be very serious. However, they're typically rare and uncommon. Anyway, she discovered there's a couple of issues. One is that they use oils, including peanut oil, sometimes in adjuvants of vaccines. So some of the ingredients can be peanut or other nut-containing oils. And of course, these things are trade secrets. They don't just, disclose that so easily.
Well, that makes sense about the peanut allergy then.
Yeah, but also the Hib bacterium, the molecular weight and the molecular structure of some of the proteins in that bacterium are very similar to that of a peanut. So there's a cross-reaction. So here you are taking this injection, a series of 4 injections over time, and your body's mounting this immune response that is, supposed to go on, and the inflammation and all of that. Then you eat a peanut, the body gets confused and thinks, oh, this is the thing I'm supposed to have a big reaction to, and then you have this, either, life-threatening or less than life-threatening reaction to a peanut.
Dr. Levitin spoke about food allergies, specifically peanut allergies, which are pervasive today. She also discussed the Hib vaccine, which can cause peanut allergies. Dr. Palevsky also spoke about food allergies, and he mentioned specifically the vitamin K shot. Many people do not realize that newborns receive a vitamin K shot at birth, even though it's been administered since 1961 by recommendation of the AAP, the American Academy of Pediatrics. According to the CDC, babies are born deficient in vitamin K, and without enough vitamin K, they can't make enough substances that are used to form clots, and they are at risk for vitamin K deficiency bleeding, or VKDB. A vitamin K shot given at birth is the best way to prevent VKDB and assist the newborn with blood clotting capabilities.
In rare instances, kids can be born with a bleeding diathesis or a bleeding pathology called VKDB, which basically means that they don't have enough vitamin K. Vitamin K is extremely important in the ability to clot, to basically clot and stop bleeding if you're internal bleeding or external bleeding if you have a cut on your skin. And so they're given a synthetic drug. The generic name is phytanadione. Why inject a child with a liquid substance, with a vaccine-like substance that contains aluminum, benzyl alcohol, and propylene glycol, which is antifreeze, when you can get the same, honestly better, source of vitamin K through diet? The mother can eat green leafy vegetables for a period of weeks before the child is born. The vitamin K from that would be transferred through the placenta. You could give an oral form of vitamin K as opposed to an injection. And although that's not going to be absorbed probably in the gut as well as transfer from the placenta, another completely reasonable way to get vitamin K into the child to have normal clotting for a problem that doesn't occur that often to begin with. I mean, most kids, I don't think that VKDB, vitamin K deficient bleeding, is that common. It's another opportunity to inject a child with pharmaceuticals my opinion.
Dr. Sani mentioned the generic name of vitamin K, which is phytonadione. On the package insert, there's actually a black box warning. An alternative to the vitamin K shot is oral vitamin K. There have been no studies indicating that oral vitamin K causes childhood cancer. However, a 1992 study in the British Medical Journal was the second study to confirm a link between the vitamin K shot and childhood cancer. I want to read the conclusion of this study. The only two studies so far to have examined the relation between childhood cancer and intramuscular vitamin K have shown similar results, and the relation is biologically plausible. The prophylactic benefits against hemorrhagic disease are unlikely to exceed the potential adverse effects from intramuscular vitamin K. Since oral vitamin K has major benefits but no obvious adverse effects, this could be the prophylaxis of choice. At the beginning of the last segment,